Have you ever heard about telemedicine? What lessons have we learned about telemedicine that will shape our future? How do we ensure that patients have access to newest technology to connect with healthcare provider? Can telemedicine really replace traditional in-person healthcare provider? Now, these are just some of the questions that have been asked frequently as telemedicine gains popularity in countries around the world, including Malaysia. Hi, my name is Ahmad Fitri bin Nur Basir. This video is for my assignment under subject ELT 590, and today we will be discussing more on the hot topics, which is telemedicine. Telemedicine is a rapidly growing field in Malaysia, driven by advances in our technology and the increasing need for healthcare access in both urban and rural areas. Malaysia has been implementing telemedicine services for several years now, and the COVID-19 pandemic has accelerated the adoption of telemedicine in the country. One of the key advantages of telemedicine in Malaysia is the ability to provide medical care to people living in remote areas. In many parts of Malaysia, access to healthcare can be a challenge due to geographical barriers or a shortage of healthcare providers. Telemedicine allows healthcare providers to deliver medical care remotely, which can help to bridge the gap in access to care. For example, a patient in a remote village can consult with a specialist located in a hospital in the city without having to travel long distances. This can be especially important in emergency situations where every minute counts. Another significant benefit of telemedicine in Malaysia is the convenience it offers to patients. With telemedicine, patients can access medical care from the comfort of their homes or workplaces, hence eliminating the need to travel to a healthcare facility. This can be especially beneficial for patients with mobility issues or chronic health conditions that require frequent follow-ups with healthcare providers. Telemedicine also offers patients the flexibility to schedule appointments at a time that is convenient for them, reducing wait times and improving overall satisfaction with healthcare system. In Malaysia, telemedicine services are mainly provided by private healthcare providers. However, the government has recognized the potential of telemedicine to improve healthcare access and has implemented policies to support its adoption. Did you know, in 2020, the Ministry of Health launched the Telemedicine Development Group to coordinate and to promote development of telemedicine services in the country. The group is tasked with creating guidelines for telemedicine services, develop training programs for healthcare providers, as well as support the integration of telemedicine into the national healthcare system. Now, despite of the many benefits of telemedicine in Malaysia, there are also some challenges that need to be addressed. One of the biggest challenges is ensuring that telemedicine services are accessible to all Malaysians, regardless of their socioeconomics, their statuses, or locations. This can be a very challenge, especially in the rural areas where internet access may be limited. The cost of telemedicine services also can be a barrier for some patients, especially those who do not have health insurance coverage. Another challenge is that ensuring that telemedicine services are delivered safely and effectively. This requires healthcare providers to receive appropriate training in the use of telemedicine technology and to follow best practices for telemedicine consultation. The Ministry of Health has issued guidelines for the use of telemedicine services, which includes guidelines for patient confidentiality and informed consent. In conclusion, telemedicine is a promising field in Malaysia that has the potential to improve access to healthcare and provide more convenient and cost-effective medical care for patients. The COVID-19 pandemic has accelerated the adoption of telemedicine in the country, and the government has recognized the importance of telemedicine in improving healthcare access. That services are delivered safely and effectively. With continued investment in telemedicine technology and policies that support its adoption, telemedicine has the potential to transform healthcare in Malaysia. So, is telemedicine your future healthcare system? Let me know in the comment section below. Until we meet again. Thank you.